This segment is sponsored by MUSC Health. The claims and opinions made in this segment are not necessarily those of Live 5 WCSC.
Today we're here with Dr. Samuel Oyer, Director of the Facial Paralysis Treatment Program at MUSC Health. Dr. Oyer, thank you for joining us.
Thanks so much for having me, Sam.
First off, Dr. Oyer, tell us exactly what facial reanimation surgery is.
Well, it actually involves a group of surgeries that can be performed to help treat people with facial paralysis from any different cause. And really the goal is to try to improve facial symmetry, improve facial function, and then when possible create facial movement, especially related to the facial smile.
What kind of patients typically need this surgery?
It's really a wide range. Some people are born unable to move part of their face. Others develop paralysis following trauma or a tumor or certain surgeries. And really the duration of paralysis, how long it's been there, can impact what treatment options are available. For example, in the photo here, this gentleman suffered paralysis from a bad motorcycle crash. About a year later, he still had no recovery. So we did a masseter nerve transfer. So I reanimated the face by choosing a donor nerve where he would clench his teeth to get facial movement. This young girl you see here, she had no movement from birth. That wasn't an option. The nerve transfer wasn't an option for her. In this case, I had to transplant a small piece of muscle from her leg into her face to help recreate the motion in that case.
Wow. Are there any non-surgical options that are available?
Yeah, there sure are. The most common cause of paralysis is Bell's palsy, and a lot of these folks will get most of the way back in terms of recovery, but some don't. Some have some facial twitching, some spasm, and in these cases we can treat them with Botox in clinic, among other things. We also have a facial paralysis physical therapist who really helps them with their recovery.
Now, why should a patient choose MUSC Health over so many of the other options in the Charleston area?
Well, we really have a whole team that looks at this pretty exclusively. So we have the most comprehensive treatment options available, everything from the in-office and physical therapy options to the complex kind of microsurgical treatments available.
And lastly, tell us a little bit about your personal treatment philosophy.
Well, every face is different, every face is unique, and facial paralysis affects people in a very unique way. So my philosophy is to look at each person in that light and really get a sense of what their goals are and to really help them achieve those goals and tailor treatment towards each patient.
Dr. Oyer, thank you for joining us.
Thanks so much.
For more information, please visit muschealth.org.